My name is David Fabi, and my specialty is orthopedic surgery. I've been practicing medicine since 2010. I practiced medicine at Scripps Hospital. I became an orthopedic surgeon for multiple reasons. One, I first got exposed to an orthopedic surgeon because I was an athlete growing up. I dislocated my shoulder a few times, and that's the first time I visited an orthopedic surgeon, and it gauged my interest. I knew I always wanted to go into medicine because my mother was a doctor, and I just found as I went through my training, these are the surgeries, these are the type of patients that I wanted to care for. Well, my area of specialty is hip and knee arthritis, in particular hip and knee replacements. That's my passion, that's where my passion lies. I love it because one, industry in terms of joint replacements is always improving. We're always looking to be better, always looking to provide better care and better results for our patients. On top of that, these are patients that are looking for better quality of life, and these joint replacements are working so well that we're able to offer and achieve that for our patients. So a big part of what I do is minimally invasive joint replacements, meaning less collateral damage to the knee. We're doing it through smaller incisions, and with that, patients are recovering a lot quicker, and more we're starting to do these at an outpatient, as an outpatient procedure. That's how we trained. I was trained with a surgeon that did about 80 to 90% of his joint replacements were going home the same day of surgery. So I focus on quick rehab and quick recovery in my patients. So the age range of patients that I see, particularly with hip and knee arthritis, range from 40 to 90, so it's a wide range. With the baby boomer population entering the Medicare population, there's been a huge spike of patients that are candidates for hip and knee replacements. So that keeps me busy, but at the same time, patients are looking to stay active. So it's good for their cardiovascular condition and their quality of life. It makes them happier. I choose Scripps Mercy because there's always a dedication, always a motivation to be better. The people that are involved, the doctors are involved, the whole staff, they believe in this hospital. And that's where it starts. You gotta have a belief and you gotta have a passion for it because there's no substitute for passion. Well, when a patient comes to see me, and I'd hope, and I try to give that patient the best clinical experience that they've ever had. One, because I have a lot of compassion. I believe I went into medicine for the right reasons, and that's to help people first and foremost. They should also expect to get a hug from me because, connection between a doctor and a patient, I think, is a very important relationship, and it's a privilege and a relationship I don't take lightly. There's a lot of satisfying aspects of my job. One of the most rewarding that comes to mind is when that patient comes in my office at a week or two after the operation, after total hip, total knee replacement. They're almost fully recovered. They're smiling ear to ear, giving me hugs, and it's not just them that are happy, but it's the family that's happy. So that's what fills my plate. That's what fills my cup. That's what it's all about.